Brain disease, stroke. A video in a video series by Emily Castley. Now let's talk about the symptoms of stroke. Our first symptom is sudden weakness or numbness in the face, arm, or leg on one side of the body. Our second symptom is an abrupt loss of vision, which could also be sudden dimness of vision, especially in one eye. Loss of strength, coordination, cessation, speech, or the ability to understand speech, and these symptoms may become worse over time. Then you might also have a sudden loss of balance, which is possibly accompanied by vomiting, nausea, fever, hiccups, or trouble with swallowing. Then you can also have a sudden and severe headache with no other cause, followed by a rapid loss of consciousness, unexplained dizziness, or sudden falls, and these are all indications of a stroke due to bleeding in the brain. Now, what is stroke / what causes stroke? Stroke is when the blood supply to the brain is interrupted or blocked for any reason, and the consequences are usually dramatic. Control over movement, perception, speech, or other mental or bodily functions is impaired, and consciousness may be lost. Disruption of blood circulation to the brain may result in a stroke, a disorder that occurs in two basic forms, both potentially life-threatening. Now let's talk about thrombotic stroke. Thrombotic stroke is clots near the brain. About 3/4 of all strokes are due to the blockage of the oxygen-rich blood flowing to the brain. Called ischemic strokes, they are triggered by either a thrombus, which is a stationary clot that forms in a blood vessel, or an embolus, a clot that travels through the bloodstream and becomes lodged in a vessel. And here in this diagram, I am showing you just a diagram of a man, his brain, of course, and blood vessels. And right here is a problem area where the thrombotic stroke is occurring. And in it, we have a blood vessel that is almost clogged, a blood vessel to the brain that is almost clogged, as you can tell. Barely any room for blood to flow. And this clot is a thrombus type of clot. So now let's talk about embolic stroke. So this type of stroke may be preceded by a brief transient ischemic attack, or TIA, which is an episode of inadequate blood flow. A TIA usually lasts 15 minutes or less. These may be signs of an impending stroke, and with a TIA, circulation and vital oxygen supply are quickly restored, and lasting brain damage is usually avoided. With any stroke, however, if the interruption of blood flow lasts long enough to kill brain cells, it can produce irreversible damage. Now here in this diagram, the problem area is higher up in the blood vessels, is higher up in the vein, in the brain, not necessarily at blood vessels, and so I'll show you that a little bit deeper. Not necessarily in the lower blood vessels. And so here in the blood vessels higher up in the brain is where an embolus is blocking the passage of blood flow. And so you can take a look at that. And the embolus, of course, is that purple oval. Now let's talk about cerebral hemorrhage. Cerebral hemorrhage is bleeding in the brain. The second basic type of stroke is a cerebral hemorrhage, or bleeding in the brain. It occurs when a brain aneurysm ruptures, or when a weakened or inflamed blood vessel in the brain starts to leak. An aneurysm is a pouch that balloons out from a weakened spot out of the wall of an artery. As blood flows into the brain, the buildup of pressure may either kill the tissue directly or destroy the cells by impeding normal circulation to the affected region. This typically produces an excruciating headache, sometimes followed by loss of consciousness. In contrast to ischemic strokes, which are generally survived, massive bleeding strokes are fatal about 40% of this time within the first month. And so in this diagram, I'm showing you from the middle of the brain. And so these are all blood vessels leading up into the brain. And on the right, you will see normal activity in the blood vessels. And on the left, these are bleeding blood vessels to the brain. I'll let you take a look at that diagram. Okay, now let's talk about the treatment of stroke. So the treatment of stroke is always ongoing. One of the things used is thrombolysis, which is also known as thrombolytic therapy, and is a treatment to dissolve dangerous clots in blood vessels, improve blood flow, and prevent damage to tissues and organs. Then many medicines are used. Anticoagulant medicines, such as warfarin, prevent blood clots from forming and keep existing blood clots from getting bigger. And you may need to take this type of medicine after a stroke if you have atrial fibrillation or another condition that makes you likely to have another stroke. They also use antiplatelet medicines. Antiplatelet medicines keep platelets in the blood from sticking together. Aspirin, for example Bayer, is most often used to prevent TIAs and strokes. Aspirin combined with difridamole or agronexoc is a safe and effective alternative to aspirin. And then clopidogrel or Plavix may be used for people who cannot take aspirin. People also take statins, which lower cholesterol and your risk for another stroke. And also blood pressure medicines. And if you have high blood pressure, your doctor may want you to take medicines to lower it. And these type of medicines include anti-goitacin 2 receptor blockers, anti-goitacin converting enzyme inhibitors, beta blockers, calcium channel blockers, and diuretics. Also, when you have a stroke, you may have surgery. And surgery for ischemic stroke would be if you have a serious blockage in the carotid arteries in your neck, you may need a carotid endarterectomy. And during this surgery, a surgeon removes plaque buildup in the carotid arteries, and the benefits and risks of the surgery must be carefully weighed because the surgery itself may cause a stroke. And now, surgeries for hemorrhagic stroke. Well, treatment for hemorrhagic stroke may include surgery to drain or remove blood that is in or around the brain, repair a brain aneurysm, and in an endovascular embolization, soft metal coils or mesh is inserted into the aneurysm to block it off and stop or prevent bleeding. And in a craniotomy, a small metal clip is placed around the base of the aneurysm to block it off, and this stops the bleeding in the brain. And finally, for surgery for hemorrhagic stroke, they may also want to remove or block off abnormally formed blood vessels, which are called arteriovenous malformation, that may have already caused bleeding in the brain. And so the main points that you will need to know I have listed here, how it's ongoing thrombolysis, which is separate from everything else, medicines, which are just the four basic ones, anticoagulant, antiplatelet, statins, blood pressure, and surgery for ischemic is mainly carotid endarterectomy. And over here I'll keep listing the ones for hemorrhagic, and you can maybe copy this down for your use in resources. Now, I would also like to add in that if you are looking to learn more new information about the brain, since I'm not I do not have a medical degree or a trained medical professional, I got most of my information from WebMD and webmd.gov, and it is a government medical site, and it gives you links to other government-approved sites, so you'll know you're getting the right information. And if this kind of stuff interests you as much as it does to me, you might like that website a lot. In here, I am just showing you a few drawings of medication and what forms as it comes in, because surprisingly, as a lot of these medications aren't like hospital like injections, like you don't have to get them done, like just like we said before, they're like um like aspirin forms and stuff, so many pills. And with these medications, again, you might also want to use them for, because every case is different of stroke, for different things like that you might have problems with. Like some people have problems walking after it, problems talking. Like everyone's different. You don't have every symptom of stroke, so just different medications, like side medications for the side effects of stroke that you might have to use. So. Hey, thank you so much for watching, and I hope you enjoyed and learned a lot from these videos. And I originally planned to make this is the end of this video, and I originally planned to make only 8 videos, but if you really enjoyed these, you can leave more suggestions for new videos that I should make. And again, thank you for watching.